It is said that in golf, as it is in life, the follow through makes all the difference. And so is the case with hair transplant. It is the follow up care, the compliance to the medication, the compliance to the advice of your doctor that makes all the difference and that brings a smile to your face and a head full of hair for a long, long time to come. And so is the case with this patient who underwent a 3500 graft procedure, details of which are in the comment section below. The procedure was done to restore his hairline, to restore the temple points, the mid scalp, and also the vertex. He followed up with the advice to take a DHT blocker, and he did so religiously for 8 months till when he came for this review. The problems encountered in this case were a young age with a backdrop of extensive baldness, which was obvious, a donor area which was not very inviting, given the fact that he was having thinning of hair, what we call as reverse balding around the ears, what we refer to as the peri-auricular regions. This seemingly compromised the scalp permanent donor zone. Increasingly, we are seeing that in the age group of 25 to 35, the age group when most patients come to us for a hair transplant, in this age group, over the years, over the last 20 years of my experience in the hair transplant field, I have seen that the donor area today is not what it used to be in the patients I saw 20 years back. Donor areas today are getting more and more miniaturized, and the baldness is becoming more extensive in a younger age group. So this evolution has brought in a lot of challenges. If a patient has to experience a happiness for a longer period of time through his hair transplant, he has to keep in mind that the basic issue of hair loss is DHT. So the use of DHT blockers was never so crucial as it is today. Imagine in this patient what would have happened if he had not taken a DHT blocker. His miniaturization would have progressed to a great amount. His scalp donor would have been compromised. And since the scalp donor, the hair we take from the scalp donor, are a reflection of what the hair will be in the transplanted area in the years to come, this would have been a cause of concern. As the donor area would have thinned out with increasing miniaturization without the umbrella of a DHT blocker, his planted grafts would have responded similarly. They would have thinned out. And since we know that the result of a hair transplant is an illusion, hair transplant cannot be done in full density as it occurs in nature. Hence, even a little bit of thinning would take away from the result and would break the illusion due to which we see a result after hair transplant. In such cases, a hair transplant without finasteride is an exercise in futility. People, unfortunately, do not take this advice seriously because of loads of data to the contrary, which is misleading and is available on the internet. Many times the patients feel so much that the doctor is unnecessarily promoting this drug. And since he's promoting this drug so much, he must be profiting from it. Well, the drug finasteride in India costs a mere $5. That is 350 rupees for a month. That's not the amount a hair transplant surgeon would seek to make a profit from. So this advice is only in your interest. By repeatedly stating that you need finasteride if you want to maintain your hair after hair transplant, I am losing business because there is a greater number of patients out there who want the doctor to say that finasteride is not required. Am I not losing out on those people? So why am I stressing on the need to take finasteride? That is for you to see. However, I also stress the fact that finasteride is not for everybody. Finasteride can only be given, can only be exhibited to patients who can tolerate the drug, patients who will not have side effects from finasteride. So that is the message from this video, and thank you for watching as always, and do leave a comment below and see you in the next video. God bless you.